our Women's Veterans Public Forum. I'll be honest, my role here is pretty easy. I just listen and pay attention to what is important to you, and then the questions that you're asking. I feel very confident in the team that we have that will be presenting some content tonight, and then more importantly, answering any questions you may have. So I'll kick it over to Dr. Marshall. Oh, I'm John Ekman. I'm the director, by the way. I should have probably started with that. I apologize for the informality, but welcome to tonight's forum, and I'll pass it over to Dr. Marshall.
All right, so good evening, everyone. Thank you, Mr. Ekman. Welcome to our biannual Women Veterans Public Forum. Really excited. I've been to many of these, and we always have a huge amount of information to pass on to all of you, and hopefully you'll find it helpful and you'll give us some feedback and have questions that we can answer for you. So as Mr. Ekman said, I'm Sandra Marshall. I'm the Chief of Staff here at the VA Maryland Healthcare System. And throughout my VA career, it has been a distinct pleasure to serve the needs of our women veterans. So I'm looking forward tonight to hearing your feedback to help us serve you in the future. Joining us today for the forum are the following members of our Women Veterans Program for the VA Maryland Healthcare System. First, you heard Dr. Catherine Starpoli, who's our Director for Women's Health, Dr. Siobhan Kirksey, who's our Women Health Program Manager, Miss Janita Robinson, who's our Women's Health Reproductive Health Care Manager. That's a mouthful. Dr. Rachel Austin, who's our Women's Health Program Champion. Miss Maisha Pope, who's our Women's Health Senior Social Worker. And Dr. Catherine Vega Sanchez, who's our Women's Pharmacist. We also have a physical therapist, Miss Yates, who wasn't able to be here tonight, but we do have other members of our team. So having made the introductions, I'm going to turn it over now to Dr. Kirksey and Starpoli for a presentation about the VA Maryland Healthcare Women's System's Women's Veterans Health Program. So take it away, Siobhan.
Thank you so much, Dr. Marshall. Before we get started, Dr. Starpoli, is there anything else you would like to add for the group?
I just wanted to introduce myself. I'm just turning my camera. I'm Kathy Starpoli. I'm the Women's Health Program, the Women's Health Medical Director here at VAMIX, and I just wanted to welcome you all for coming to our forum.
So thank you so much, Dr. Starpoli. I ask as you join, if you please keep your mics muted, as we'll cover some information and want to make sure that everyone can hear the information that's being presented. We will have questions at the end where you will be able to type that information within the chat so that we are able to answer questions to the best of our ability. If for some reason we are unable to answer any questions this evening, we will follow back up and get that information to you. We ask that you please do not enter any personal information. This is not the place for that, but we do have an opportunity to follow up. We want to make sure that we maintain HIPAA and respect everyone's privacy with any additional issues and or concerns they have. And so with that, we'll just go ahead and get started. So a little quick agenda, just so you know, kind of highlights of what we're covering and what we're going to discuss for this forum. We'll talk about some September health campaigns that are currently running. We will do a high-level review again of our women's health program offerings. We will talk about reproductive health, and then we'll open things up for any questions or concerns from our veterans. So the month of September, we have two major campaigns that we are running. There's several that run at a time, but ones that we highlight and like to bring awareness to. The first being polycystic ovarian syndrome. This is a common problem that affects about 1 in 10 women, and it can alter your hormonal balance and your overall fertility and overall well-being. But yet up to only 70% of our women with PCOS remain undiagnosed. So the things that we highlight in celebrating and putting recognition to this campaign is to ensure that our veterans know that your first stop is with your comprehensive women's healthcare provider. If you are noticing that you're having some of the symptoms that are listed here, like irregular or missed menstrual cycles, acne and oily skin, obesity or trouble losing weight, maybe excessive facial hair, thinning of hair, These can be concerns that you bring up and have addressed with your comprehensive women's healthcare provider, where they are able to work together with you, order any necessary tests and procedures that are needed, and together put a treatment plan together that will help. This is a treatable condition, and our comprehensive women's healthcare providers can do an amazing job with helping to support your needs. Next is September, which is suicide prevention and awareness. Suicide is everyone's responsibility, and I highlighted just a few of the many activities that will run through the month of September here on campus. So on September 18th, which is next Wednesday, we will have a suicide prevention walk. This walk happens rain or shine, and it's at our Perry Point location. We also have our 6th annual Tree of Life ceremony that will also be at Perry Point on September 25th at 2 p.m. And then we have the SAVE Suicide Prevention Program, which provides additional support and remembrance and additional information and understanding ways that we can help identify signs of suicide and potentially save a life. So these are some campaigns that we run. The suicide and prevention team has additional services that we do, including highlighting in-services for our staff to help support our ongoing knowledge so that we can work together with our veterans. So we're going to just highlight, high-level highlight of our women's health program and offerings. So our comprehensive women's health care program offers the following. We provide comprehensive primary care within a women's health clinic, which is here at Baltimore, or it is combined in our primary care campuses, where our comprehensive women's health care providers are included within that primary care clinic to support the needs of our women veterans. We have gynecological services, maternity care, fertility and infertility services, childbirth education classes, as well as postpartum support. And our postpartum support now goes up through 12 months after delivery. We have a lactation consultant clinic that is new to us this year that we're really excited about. We provide ultrasounds and mammograms. We also have access to mental health care and counseling. We have lifestyle and whole health wellness services that we have access to and provide access to for our veterans. We have menopause clinics, and that will be highlighted a little bit in this presentation. And then we also have pelvic floor physical therapy. So this is a high-level overview. And though a specific care option may not be highlighted here, the goal that we like to make sure that everyone is aware of, if there is a question or concern, reaching out to this team or starting with your comprehensive women's healthcare provider, we can link you with the appropriate service to help support your needs. So we're going to take a little bit of a dive into reproductive health. So we want to do our best diligence to make sure that all of our veterans are informed to our trauma-informed care approach and what we go about doing. So reproductive health care visits, we are aware, can be triggering for anyone who's experienced trauma, and that is any type of trauma. The VA Office of Women's Health is dedicated to provisions of patient-centered and trauma-informed care. And with that, we work to train our team in the best practices as it relates to trauma-informed care. Dr. Austin, as well as Dr. Combs, has done an amazing job at providing that training for our staff and our departments here to ensure that we are able to provide the care that is welcoming and respectful and meets the needs of our unique women veterans. Our trauma-informed care approach is focused on comfort level. We want to ensure that we are creating a space that feels safe. You have options that allow to have a friend or a partner to support during these exams. Care is provided over time. There is communication that can be bidirectional with a set of clear expectations and boundaries that are established by our veterans. Patient empowerment is very important to us. And with that empowerment, it comes deciding the level of dress or undress that's necessary for the appointment or the exam to get that accomplished together. And there's optional exams that can be discussed with the provider. And then if needed, there's always real-time access to mental health and social work support. Most of our social workers are embedded within our team. There is a PAC social worker as well as a primary care mental health champion that will be able to help support. But what I love most about this team is always having access to Dr. Austin to help support any immediate needs and to help us coordinate our care appropriately when a veteran is in immediate need or distress within our clinics. We're going to talk a little bit about fertility and family building. This was highlighted at our last forum in March of this year when we had that forum, but it was more of kind of a news blurb. And as we know, we've had additional questions and concerns in regards to this. We want to spend a little bit more time just digging in and making sure that it's clear. So March of 2024, our fertility care was expanded. And so fertility evaluation and some treatment is now available to all of our veterans. Veterans with an infertility diagnosis related to one of their VBA adjudicated service connected disabilities or treatment are eligible to participate in ART or IVF treatment. And that also includes some treatment of their legal spouse. What was updated is that now our policy and provisions allows for the use of donor eggs and sperm, as well as embryos being permitted, but those are obtained at the cost of the veteran. Singles are now eligible for care, as well as our same-sex couples. There is no coverage for gestational surrogacy, and there is no coverage for there's no coverage for partners who are not legal spouses. So if we are not a legal spouse, coverage is still not available. So how do we go about getting started if there is an interest? First, you want to make an appointment with your comprehensive women's healthcare physician or nurse practitioner. They will facilitate the appropriate consult to care in the community with an infertility physician or specialist. And this is based on your conversation and options that gets discussed with that comprehensive women's healthcare provider. Most of our veterans starts with an infertility evaluation. This would be the initial step, especially if our veterans are unsure of the cause of the infertility. We do not have mechanisms or ways within the VA to kind of do the evaluation internally. So this is where we partner with our community providers to get this done. The other option that's available is IVF, which is our in vitro fertilization. This is the only benefit for veterans with specific service-related conditions causing infertility. Okay. After a visit is completed with an infertility specialist, a treatment plan will be provided to both the veteran and it's also sent back here. This provides additional information for your comprehensive women's healthcare provider to know if there are any additional consults that need to be ordered to help support your care while in the community. So to receive these benefits, if they're recommended, there has to be a service-connected disability that is the cause of the infertility. An infertility evaluation by a reproductive endocrinologist suggesting the care plan or treatment plan for IVF. And then you have to obtain and submit a VBA adjudication letter concerning your service-connected condition. So at times when we're worked up by our reproductive endocrinologists in the community, they outline specific reasons or rationales as the cause of your infertility. And that is used together with what has already been discovered during your benefits process. And that's how our physicians here evaluate cases and a case is submitted and made when it comes to infertility. So we take the treatment plans that have been recommended, as well as the causes of the infertility to put a package together to be evaluated for approval or denial of these services. These are some steps, which are very lengthy steps, but they're pretty quick when you go through them in terms of how to get your adjudication letter. The first is navigating to va.gov and you would sign in using your appropriate sign-in options. You're going to click on VA benefits and healthcare, which should be at the top of this website. You'll see a drop-down menu and you're going to select disability. Under that disability, you will check your claim or appeal status. Okay. Finding the claim you're looking for. If a decision has not been made, you will not find a decision letter. If a decision has been made, the status would be closed, and that is the letter that you want to select and provide a copy to our maternity care coordinator or the person that has contacted you to ask. Most importantly, it's usually Ms. Robinson, our maternity and reproductive health coordinator, that is requesting the additional documents to help you put your application together to move forward with trying to become approved for these benefits. Next, we're going to talk a little bit about pregnancy-related care when things kind of don't go according to plan, okay? And this is a difficult subject for some. So if you need to remove yourself from the call and hop back in, I believe there's just 2 slides that are here, but we want to make sure we're creating a safe space for everyone that's on the call. So when we talk about this, this is management of an abnormal pregnancy. This could include miscarriages, a topic which is pregnancy outside of the uterus, pregnancy loss and or stillbirth. And then we offer a multidisciplinary care with our maternity care coordinator, gynecologic team, women's health primary care team, and psychiatry if needed. So we offer all veterans with a positive pregnancy test the opportunity to discuss options. For veterans for whom a pregnancy would endanger their life or health, or is a result of rape or incest, the VA offers abortion services. Those services are not rendered here on site. We do partner with the experts in the community because this is a service that is new to us and we have not had the opportunity to provide these services on campus. And we want to make sure that our women veterans are getting the best possible care. So we connect with our community partners for this services. These services could be medication, where medication is prescribed to help, or it may actually be a procedure. And again, we coordinate with the community partner. There's a specific team here. Most of us are on this call that helps coordinate care and follow up with someone that may need to go through any abortion type related care. The same opportunities are afforded for any maternity care patient that unfortunately experiences a loss. There's a team available to help support with that transition and to ensure that they have the needs to help support them. Next, we'll talk about our menopause clinics. We have 2. One, and the purpose of the clinics is to educate about the health issues related to menopause and increase the risk of other conditions during this stage in a woman's life. So the first is our gynecology menopause clinic. It is located on the 5th floor here at our Baltimore main campus, and it's in the gynecology clinic. They offer 2 days of services when it comes to this particular clinic for now, but are looking to expand. So that's Tuesdays from 1 p.m. to 3 p.m. and then Fridays from 9 a.m. to 3 p.m. The services offered at this clinic may include comprehensive menopause assessments, hormone replacement therapy, lifestyle and dietary counseling, osteoporosis screening and management, sexual health counseling, and management of menopause-related symptoms such as hot flashes, mood changes, and sleep disturbances. Some of this care may have already been provided in a comprehensive women's health care clinic with your comprehensive women's health care provider. But we do have additional services available within our gynecologic suite to ensure that any additional concerns, any additional needs are addressed there and in a timely fashion with staff that are engaged and willing to help support. And then we have our menopause medication management clinic that is located on the 2nd floor here within our Baltimore VA Women's Health Clinic. These can be done in person, but also have a virtual, what we call a telephone appointment associated. The goal is to provide non-drug options for managing menopause symptoms, evaluate the proper use of drug therapies for treating menopause symptoms, and discuss the risk and benefits of hormone therapy and non-hormonal treatment. Additionally, they can discuss cardiovascular risk if needed, refer to other clinics like our pelvic floor physical therapy clinic for nutritional services, our gynecological clinic, and mental health, and address coexisting conditions like depression, weight management, hypertension, diabetes, hyperlipidemia, family planning and contraceptive, and female sexual arousal disorder. So we have 2 clinics that are available. Both have different requirements. For our menopause medication management clinic, that is a phone number that you would dial to get scheduled within that clinic, and that's within our women's health clinic. That phone number is 410-605-7000, and the extension is 54981. For our gynecologic menopause clinic, a referral or consult is required by your comprehensive provider. They will do an intake screening and then get you scheduled as soon as possible within that clinic. So a couple of quick new happenings, and not much. But one is our exciting lactation consultant clinic that is led by Janita Robinson, our maternity care coordinator, and she is also a certified lactation consultant. Our goal is to empower our mothers and families to have a positive and successful breastfeeding experience through expert guidance and compassion. This clinic is Monday through Friday from 9 to 11 a.m., virtual, and can be done in person by request. So the last time we met, there was a lot of questions and concerns regarding resources and access to resources. We have listed here a couple of links that will help support that, but also the biggest thing that came up was access to either additional groups as well as any additional clinics specific to our women veterans. Now, what I will say is that link is very extensive. So there is some information that we will drop in the chat. And there is another list that can be emailed out so that everyone has access to it. So everyone and anyone that was invited to this forum this evening will receive a separate email that has the list of additional resources. Most of our clinics or groups have different ways and mechanisms to go about working together with them. And so we will provide those additional resources and tools for everyone. And this is a list of all of our clinics and their locations. So we have comprehensive women's health care within all of our locations. So Baltimore, Perry Point, Lock Raven, and then our community-based outpatient clinics, which is Cambridge, Baltimore County, Fort Meade, Glen Burnie, and Pocomoke. Just a little nod in reference to our Women Veterans Call Center to remember if in fact you can't get a member of this team, you can reach out to them. They help route you to the correct campus and to get the additional information that may be needed to help support. Phone numbers are listed here. Most of the referrals that come into them can be either handled the same day with this team that answers the call, or they route them back to the appropriate women's health campus to ensure that all questions are answered and we get you connected to the appropriate level of care timely. And we will open it up for questions. Any questions that you may have, please type or drop them into the chat at this time.
All right. Thank you, Dr. Kirksey. We already have a few questions.
Okay.
At this time, though, we'd like to hear from you, as Dr. Kirksey said. Please enter your questions or your feedback into the chat section on the screen. While we're waiting for the questions to be entered, please remember we wish to protect your privacy, so please do not mention your personal health condition or any personally identifiable information. If you have a specific medical concern, you should contact your VA provider. So the first thing, thank you, Dr. Kirksey, for showing us what the locations were where you can get comprehensive women's health. That was one of the first questions, was this only at Baltimore? Now, our GYN services are at Baltimore, but we do have comprehensive women's health at the other locations you listed. I have two veterans who indicated that they go to the DC VA, but they live in Maryland. And can you speak at all to the services available at DC, or can they avail themselves of switching and coming up to our program?
You can always switch and come up to our program, but our program is very similar and looks very much alike. So there is a women's veteran program manager like myself there. There's also an assistant program manager there. They have a team that works together as well as women's health navigators to help support. But there is no problem switching. If you live in Maryland and would prefer a campus within Maryland that's closer, whether it's coming into our main campus at Baltimore or a few of the community-based outpatient clinics that I mentioned, that is very much doable and possible. We would just need some additional information to get you started there, and you would definitely have to enroll into care, but it's up to you whether or not you want to switch. Sometimes our programs look a little bit different because there's different leaders, meaning there's different things that we at times focus on, but we do collaborate and work together and we share best practices. So if we know something here has had a great success, we have those same conversations with our colleagues to see if they can instill the same program there, or we work together to do something called an inter-facility transfer or consult if that's needed, so that our veterans that are enrolled in one campus are still able to receive care at another campus. One of the things that our DC campus does very well is they have a postpartum, and I think I might need Dr. Austin or Maisha's help with this, but I believe it's either a oh, I remember what it is. It is a pregnancy loss support group. That is amazing. And we don't have that particular support group here, but we do use an interfacility consult to help coordinate care together.
Okay, we do have one veteran who said that she was here last March. She'd been getting copay bills for some recovery center classes that she attended at Perry Point and hasn't been reimbursed. Her second issue is that she's been waiting for a brace since last fall, so also has not received that. So what I would ask is, Siobhan, can you give the number where she can call? Well, you've got your phone number up there, is to call and give that information specifically about yourself, and lets us have people in our MAS, our Medical Administration Service, find out what's going on with your billing, and we can get your provider to see what's going on through prosthetics about the brace. One of the questions was, can you give us the names? And I'm not sure which names they're asking for. But they'd like to know the number for the menopausal workshop again. Oh,
So for the menopause clinic, Dr. Sanchez beat me to it. She
I was
just
gonna
dropped it
say,
in.
she just popped up.
I'm sorry, I asked for the names. I'm talking about the managing people that you were talking about that's at the DCVA.
Oh, I'll drop
you
their
mentioned-
names within the chat.
Okay, thank you.
Mhm.
Also, one more before because I was trying to type it, it was be quicker to say it. Is there a person or a team that goes around to the different VA facilities giving MST sensitivity training? I can't tell you how many times I've been triggered because there's just no constant training going on with because our facilities are training facilities. So there's a lot of students or residents or even some staff doctors that just don't get it, and they cause more trauma
So are you speaking within the VA walls or within the community?
within VA walls.
Okay. So within the VA, again, as I mentioned, each campus is a little different in terms of that training. So Dr. Austin and Dr. Combs does specific training here in Baltimore for specific clinics that have been identified, meaning if we get information from particular veterans that have been triggered or something happened where we needed to investigate, we do that. But trauma-informed care is an initial training that's done by all in terms of that environment. And then where we see that there are additional issues or concerns that our women veterans have brought about to us, then we have Dr. Austin and Dr. Combs do retrains and updates. And we have sent them around to several locations that have experienced that type of trauma in a different area so that we work together on that. The goal is to have it as an annual thing. So that is our goal, and that's what we work towards to ensure that all of our staff and our team members are trained annually. But you are correct. Our residents, we're a teaching facility, and so that turns over quite quickly and sometimes quite often. And so it's getting a rhythm in place where anyone can participate in that training as they're coming in.
Oops. Been cut off. Okay, now I'm back in. Can I get the doctor's email so I can give more information because it's not happening at the DCVA? Oh, the doctors who are providing the trauma sensitive care? Those,
So Ms. Ellis, can you please reach out to me? My email is on the screen. Send me a separate email and I will send you that information. I will have to coordinate with Shayna because I'm not exactly sure. I think I remember one of the providers' names, but I don't know if they directly do the training is available to everyone within TMS. So that is one part of the training that is available. TMS, I'm sorry, is our talent management system for all of our staff that are hired within. And then the other that we do here at Baltimore that is a little separate is the one that Dr. Austin, Dr. Combs does in person with our specific departments. So it's in addition to what's already available to our staff within our talent management system.
Okay, waiting for another question. And I know you didn't bring up what we're doing next month, but next month is a big month. Dr. Kirksey, about
It is.
activities
It's
that we have
breast
planned.
cancer awareness. It's one of the big months that everyone gets so excited about. We do special campaigns and special outreaches. We participate in a number of things within the community, especially the breast cancer walk down at Camden Yards. Some of them why more inclined veterans and staff are looking for a few races. So I'm looking for additional races that can be that we can participate in as well.
Okay, so we have a question about whether there's an age limit for the IVF program.
So the age limit for IVF will apply as it applies to our normal population. So if you're of advanced maternal age, so there is a conversation that happens between your reproductive health team or your comprehensive women's health care provider. And that's the guidance in terms of you having a safe baby. And so with now us being able to use donor eggs as well as donor sperm, the age of the veteran themselves may not be limited. But again, as I mentioned in the slide, what we do not pay for is surrogacy. So if you are a veteran and you're 50 and you want to have a baby, but you've had the conversation with your reproductive health team and they don't advise that you carry, then you do have the option to still move forward, but we do not pay for surrogacy. So the benefits and the services that we would pay for would need to apply to the veteran. And so if you're unable to do those services, then the cost would be out of pocket for that veteran. I hope that answers your question. If not, you can put a clarifying one.
Okay, how do we find out about services that are located at our facility?
So I think you're still talking about DC, and DC holds a public forum just like this one. So they should have the same resources available. I think what becomes hard for all of us is the mechanisms at which we get you resources. Within the VA Maryland healthcare system, I use several resources. So we send out emails, we update our medical media pages. I use a lot of social media. I work with public affairs to put different things in newsletters so you have the most up-to-date information, but sometimes new clinic or support groups get created very quickly and then moves on to something else. And so it's just about ensuring that everyone gets the same information. If you've been going, I have no idea because again, it's that DC location. I've only been in my role for the 2 years, so I can only speak about how I currently go about ensuring that our veterans receive updated information. A lot of that has to do with ensuring that they have correct addresses for you, because I do know most of our VAs send out newsletter and updated information, and that is a mailer. If they are using virtual, then ensuring that you have the correct email address on file with us. And then you need to subscribe to at least our social media pages. So we have social media on Facebook. I believe we have YouTube, and I also I think we have Instagram. So those are the locations that I work together with our public affairs to ensure that we're disseminating as much information as possible. That's also where we talk about topics. So like on our Facebook page right now, I know that there's several different videos, some for women's health, some from other services that highlight programs, great works that we do, specific topics that have come up that need additional education and support on.
Okay, our next comment wants to thank you for all that Maryland VA does for veterans. Appreciate the session. They wanted to know what type of care coordination is being used with breast cancer patients.
So if you are actually diagnosed, that team has a care coordinator that works together with it. Most of your care after you're initially diagnosed sometimes is in the community. So what we do have here, and Dr. Starpoli may hop on to add, if you are screened and you're positive and you have all of your imaging done, we have our breast surgeon here that you would get an appointment with and you would see, and they would work out the treatment plan. Generally, the treatment plan can be done in the community. That same doctor is also associated with our community partner, University of Maryland. So that treatment program may be put together with University of Maryland if that's so choosing. If you're further away from the office, it could be someplace else. But there is a treatment plan that is developed together with your oncology team, and most teams have a care manager with it. We attempt to stay in contact with the veteran if we are aware, or within your consult, there's information given to the provider to reach back out to us. Sometimes there are things and services that you may need that are still available to you through the VA, but we just need to know about that. So maybe lymph nodes needed to be removed and you needed a sleeve. A sleeve is one of the ways that we would go about getting that, and that's a benefit that you're entitled to, but we need the information so we can get it ordered. So some of this information is afforded to the community provider in the authorization that they receive, but there really is the line of communications, and part of that happens with care in the community. They have nurses there that are also supposed to understand what may be needed for care, and if they're not clear, then they route that back to the team here. But a singular person that helps coordinate care, no, it's very multidisciplined and interdisciplined at times. And if we are not carefully coordinated together at times, just within human error, not on purpose, something may get missed. But that is why we encourage our veterans to advocate and call back to us if there's something that you need or if something has been missed.
Hi, it's Siobhan. This is Kathy Starpoli. I'm the Women's Health Medical Director. I just wanted to say also that we have cancer navigators that work through our oncology department that work as care coordinators to help set up interdisciplinary care and follow cancer patients through their journey, essentially. We do have now a breast surgeon on site at Baltimore, which is a great addition to our program. And she works with a nurse practitioner as well. And they are kind of where we usually start with when someone has breast cancer. They evaluate and they will suggest a regimen, consult with radiation oncologists. We also have radiation oncology at the Baltimore VA and oncology. So we have all of those services. They send out for all the genetic markers. It's very up-to-date care here. And we do have the cancer navigators that can help to coordinate between these different disciplines because often cancer care is interdisciplinary.
Okay. The next question is about whether CLC referrals are going from 6 months vice 1 year in length. So I'm not sure whether they're asking about the length of time to be in a CLC or referral to be admitted to a CLC. So
I think it may be care in the community. I think that's what the
I think
question
the
may be asking.
CITC. Oh. So if it's care in the community,
A care in the community, if I'm hearing it correctly, Dr. Marshall, if I'm looking at it also, care in the community referrals are a year length. So once it's approved, it is good for a year, but then it does need to be renewed. So I'm not quite sure about the 6 months, but an approval is for 1 year, and then it needs to be reauthorized again if the care
Some
is needing to be continued.
and some care in the community consults are only authorizable for 6 months.
correct. So it depends on what the services that you're receiving. There
Exactly.
is what is known as a CEOC, which is a standard episode of care, which the VHA uses just like all private health care facilities, and it outlines that if you have this condition, you get this many appointments and these kinds of tests and those things. So it depends on what you are receiving it for, but there are some that are good for a year. So that is, Dr. Kirksey is correct. There's a question whether they can switch just for women's health care. So if you come to the Baltimore VA or one of our community-based clinics, we have one in Glen Burnie, one at Fort Meade, and one at East Baltimore County at Rosedale. And they're fabulous clinics. So you would switch your primary care and your women's comprehensive care here. We do have veterans who receive care at more than one location, but we're happy if you contact us to set up your primary care and comprehensive women's health with us. There's a question about whether there's an MST clinic that provides therapy.
There is, and I asked Dr. Austin if she can pop the information for Dr. Calmes within the chat so that we can get that for them.
I'm happy to speak on that too, if that's helpful.
Yes.
So, hi, everyone.
you.
I'm Rachel Austin. I'm one of the psychologists that works in primary care, and I'm VA Maryland's Women's Mental Health Champion. So there's a couple different resources for folks for MST services. We have an MST coordinator, Dr. Calmes, who I'm going to pop her information in the chat as well. She is very easy to reach, and also a consult can be placed by any of your provider for MST services. She runs a group, and she can also triage you to an appropriate level of care. Sometimes people would like to go to our general mental health clinic. Other times folks will want to go to our PTSD clinical team. Just really depends on what your goals are and what your needs are. I'm also going to plug there are psychologists embedded in primary care. So if you are in for your primary care visit, that is a easy access point to get scheduled with a primary care psychologist for a triage, because that is step one that's required prior to seeking any trauma focused treatment. But you do not need a triage if you wanted to participate in the group, for example. So I'll pop her information in the chat. Our vet centers are also good resources for MST services. That's one of their eligibility criteria, and that's a resource that is under the umbrella of the VA, but it is in our communities all over Maryland, and it's free counseling services, and they also have groups and just wonderful counseling resources as well. So I'm going to put my number as well as if anybody has any questions.
Thank you. And I see that she's got Dr. Calmes's information in there. You put quite a few people in the chat box. So the mental health and social work information is there, as well as the MST coordinator, Dr. Calmes. So lots of great information for you to see and contact numbers. And I must say that I know that this is my facility, our facility here, but I'm really proud of the women that we have that run our women's health, veterans health program. They're very committed to your care, and that's why we're out here tonight to hear how things are going so that we can make things better. But the VA has continued to increase services as we've learned about the needs of our women veterans and plan to continue to do so. So we're here for you. And if you haven't been to our East Baltimore campus in Rosedale, it's phenomenal, brand new.
It's a beautiful
wonderful
campus.
staff, and they have openings. That's why I'm going to make a pitch for it, because you can get an appointment right away. We just opened that clinic not too long ago, so a few years. Then the pandemic hit.
Does anyone else have any other questions for us or something we didn't answer?
All right, hearing that pause, I want to thank you again for joining us for our Women Veterans Forum tonight and participating in the event. Your participation helps us to better understand your healthcare needs as we work to ensure we're providing safe, quality, and compassionate care in a sensitive and welcoming environment for all of our women veterans. If you don't know the statistics, about 15% of our veterans that we serve now are women, and it's our fastest growing demographic. So we really look forward to offering more services and being able to provide the care that you need. Please look forward to the email invite for our next forum in the spring. And I know Mr. Ekman would like to also thank you all for being here. That was your cue, Mr. Ekman.
It really is. I appreciate hearing the items that are important to you so that we can deliver care that you are looking for and the best care that you deserve. And I appreciate your service. I was typing in the chat box the same thing. So I'm very thankful of our care team and our care providers that are giving you the content today. And I'm also thankful for your service. That's all I had for this evening. I'm certainly not ending it, but I'll kick it back over to Dr. Kirksey.
So I just want to thank each and every last one of you. Most of the growth in the program and the strength of our program is from feedback from all of you guys. So we try to make the center that you want to come to. We realize that this has been very much a male-dominant arena for a while, but we work to hear your issues and your concerns and expand the program to one at which you would like to participate and recommend others to want to participate in this program together. So the more information you give, the better we are to improve the access to the program. So thank you guys so much for joining us. You have my contact information if you need anything else, and have a great evening, everyone. Thank you so much.
Siobhan, I'm going to give you a